COVID-19 continues to mutate in different countries, raising public fear that vaccines may turn out powerless against these new variants. Johns Hopkins Bloomberg School of Public Health Vice Dean Joshua Sharfstein discusses the ability of vaccines to provide protection against these new strains as he speaks on Bloomberg Surveillance.
Well, it looks like from the evidence we have that the vaccines do work against the new strains. They may not work quite as well for any type of COVID infection, but they seem to work pretty well still for severe COVID infections. So it still absolutely makes sense to get vaccinated. I think the longer term question is going to be whether the vaccines need to be tweaked a little bit to be even more effective against these strains. I don't think this is a reason to panic. I think it's just a sign of how difficult this challenge is, and we have the technology still to outsmart the virus.
What is the number one thing that we need to keep an eye on? If you look at the number of doses administered, can we make enough doses to try and get ahead of these new strains?
Well, I think it's about making the doses and delivering them to the right people, including a lot of people who are at risk. In the United States, there's some very good reporting about essential workers who are out there and are incredibly vulnerable to getting sick, and they're struggling to get in line in some places for vaccination. I think they're going to be a really important population because it's through people who have to be out and about that the virus can really spread.
How are we doing? How's the U.S. doing compared to Europe, compared to the U.K. and other parts of the world?
I think you're starting to see the wheels starting to move in the United States. There's more vaccinations happening. The stories that the pharmacies are really getting involved are good news. I'd like to see more outreach vaccinations, more attempts to go to people, go to workplaces that are really full of people at high risk for COVID-19. I'm a little worried people are, so excited they're coming out of their bunkers to get vaccinated, which is good for them, but it's not good for it's not as optimally efficient for reducing the transmission in society because they weren't contributing to that before. We really need to help find people who are in harm's way because of what they have to do for a living.
How long from, when 70% of the population is vaccinated, do we, have to still wear masks and social distance?
It's totally going to depend on how much virus is out there. So if we can vaccinate people who are at risk for transmission, that'll help. And we'll start to see the number of cases come down. As the number of cases in the community come down, that's going to be the number one thing affecting social distancing and masking.
When you speak to doctors here in the UK, I know they're very worried about the cold chain or the fact that once they have the vaccine out and somebody doesn't show up for an appointment, they need to find someone else quick or it's a waste. How are the other vaccines going to be a game changer if you don't need these below freezing temperatures?
Well, first of all, for those cold chain vaccines, you have to have a backup. You have to assume that not everyone's going to come, and these systems have to figure out how to still use the vaccine. I do think that these new vaccines that aren't cold chain will be very helpful because it'll be much easier to spread them out in small, allotments that will make it possible for more people to be holding vaccine. It'll be easier for people to get vaccine closer to where they live and work.